Diagnosing ASD is much more difficult as there is no real test that objectively states that yes, you have ASD. It is more of a subjective diagnosis, which is done by pediatricians and trained specialists. What we have here on the slide is an example of a questionnaire parents will be filling out at the 3, 6, 9, and 12-month mark every 3 months until the child is 4 years of age. This is called a modified checklist for autism in toddlers. It's a yes or no survey questionnaire, and based on the number of yeses at the end of the survey, the parent is able to receive a score that puts the child in a low, medium, or high risk for ASD. The definitive diagnosis must be made by a doctor to confirm and state the presence of ASD for the purposes of this study. Logistic regression is going to be used as an outcome, as the outcome as it affects one individual element. In this case, the element or intervention is the presence of gestational diabetes after the 26th week of pregnancy. Logistic regression is appropriate for this research study as the outcome must be mutually exclusive or dichotomous, meaning that the outcome is either A, the child develops autism, or B, the child does not develop autism. So basically, after all the blood sampling has been done to test the glucose, cortisol, and serotonin levels, we're going to use a series of graphs and charts to congregate all gathered data, and the data will have to be assessed to find patterns and information. Through descriptive analysis, we'll help organize and correlate and ultimately note gestational diabetes diagnosis after the 26-week mark. However, it may not be until years later that the ASD diagnosis can be made. That will have to be noted. The study is going to be using test and retest reliability methods by giving the same test on 20 separate occasions, which is the 20 blood tests. A score of 0.8 is acceptable and hopes to be found in this case. Bivariate analysis is going to be used to simultaneously analyze both variates, ASD and gestational diabetes, and explore relationships between the two and determine the presence of an association or correlation and its strength. We're going to be using binomial testing rather than a chi-square test to compare the observed distribution to the expected distribution because there are only two categories, and this will also likely give a higher p-value as well. The ethical issues expect to be fairly minimal as the study is more observational in nature and you're not interfering or withholding treatment. There's no control group or placebo group, it's just simply more observational. The only ethical issue or drawback would be if a subject decides to withdraw consent, in which case we could not use any of their information in the study. Limitations of study. Loss of follow-up due to missed or skipped appointments. It could be where we would be missing information or if people move away. The study is 5 years in length approximately, so a lot of things can change over 5 years. Something we hope to use is to provide some sort of incentive so that people do continue with the study. Another limitation is paternal information may still be unknown. The fathers may not be involved or the information may not be involved, so that may not be able to be used as we'd hoped in the proposed study. And pregnancy awareness differing dates, meaning if a woman does not know she's pregnant until 3 months in, some of her pregnancy blood tests will be post-birth, which can skew results. There's a large demand for more information to increase knowledge and improve clinical practice on the correlation between gestational diabetes and ASD. The proposed longitudinal study will provide the healthcare field with data that can improve standards of care and hopefully decrease the prevalence of ASD in children in Ontario. Thank you for listening.